So tonight we are digging deeper into the rise in COVID cases.
We're talking to healthcare professionals about why this is all happening, what's next, and what to expect.
WRTV's Nikki DeMentri is live outside of the Indiana State House.
And Nikki, what are you finding out about Indiana's COVID crisis, and what can you tell us?
Well, Mark and Amanda, we asked the state health department today to comment on this situation and this growing surge. They said this surge is because of the Delta variant. A spokesperson in a statement also pointed to the fact that since June 1st, 97% of hospitalized Hoosiers for COVID-19, I should say, are unvaccinated. But I want to take us back an entire year, almost a year to the day. This was the 2020 Indy 500, an unprecedented year, as we know, with no fans in August. At the time, there were 655 new cases and 12 deaths. Today, almost a year later, as we mentioned, there are more than 3,100 cases and 6 new deaths. This weekend, we're going to see the first preseason game for the Colts. Officials there announced masks are recommended, not required, and the stadium will see full capacity. Now, you have to caveat this all with, of course, the fact now we have vaccines. And I was on a call earlier today with a transplant doctor at IU Health about booster shots for immunocompromised Hoosiers, but the conversation quickly turned to what we're seeing right now with Delta and COVID-19.
We still have plenty of ventilators and beds available for any patient that needs to be admitted and receive intensive care or just supportive care in the hospital. So that is not a major concern at this point. However, it is always something important to consider if this keeps going up.
And I asked the doctor how he is feeling personally after essentially saying the same thing for the last year and a half. Make sure to mask, social distance, and get your vaccine for well over a year now, as I mentioned, as we're seeing hospitalizations and COVID cases rise once again.
Well, it's certainly frustrating and a little disheartening to see a large amount of the population not going for vaccinations, what is probably a only good way to get out of this problem. So the goal is within reach, and we're just letting it slide. And it's quite difficult to see some of our patients, including the immunocompromised patients, doing everything that they can to protect themselves.
And Mark and Amanda, it's that same sentiment that's felt by so many doctors, nurses, and really anyone in the healthcare industry right now. They're tired and they're frustrated. You have to remember, many of them have been at and trying to fight this COVID-19 virus since March of 2020.
And we do salute them, Nikki, and respect the fact that they are putting in extra hours there. You know, Nikki, we are talking about COVID here, obviously, but what are you hearing about other respiratory viruses this year?
Yeah, Mark, so that's the million-dollar question here. What about a twin-demic? As we heard the term come up last year, what does that all mean? Well, that means a bad flu season during a peak COVID surge at the same time. The simple answer here is we just don't know at this point if that is going to happen. Now, we do know influenza last year was extremely low case-wise. Doctors say that's because of the health measures taken to fight COVID-19. I asked one local public health expert, I should say, this week on his feelings heading into flu season.
We're hoping that, again, these measures, wearing masks, staying physically distant, will help protect us from a twin-demic, as you say, or at least from a bad flu season.
What happens if we don't follow those measures?
I think we could end up in trouble, to be honest. I think that, having COVID and influenza at the same time is possible. Co-infections are possible. And, we could expect to see hospitalizations to increase. We would expect to see more people being admitted into the intensive care unit and maybe, unfortunately, mortality increasing as well.
As for when you should get your flu shot, doctors say earlier is better than later. Why? Because it takes about 2 weeks, just like the COVID-19 vaccine, for that protection to fully kick in. Now, flu shots you normally start seeing at pharmacies the end of August, beginning of September. Live in downtown Indy, Nikki DeMentri, WRTV.